Well, we have to take you on this journey, and we'll be asking some critical questions. And myself and Koji Yankson, we're going to have an interaction with officials at the University of Ghana. Now, scientists at the University of Ghana, they've obtained some critical information about the virus that is causing the global pandemic, coronavirus. Okay, now that will enable tracing of community infections in people in plain language that did not come into contact with confirmed cases, for example. Now, the team analyzed samples from selected cases to gain a global, comprehensive understanding of variations of the virus in terms of their mutation. And these, in terms of the cases and the samples collected in Ghana. Now, 9 samples were analyzed from travelers, for example, who arrived in Ghana from countries such as the UK, Norway, Hungary, India, and the United States. And then they also analyzed samples from cases locally. And it's showing that there were infections of people, as also announced by the Ghana Health Service, who had not come into contact with anybody who had traveled or who had come into contact with an infected person. Now, we need to get a proper scientific understanding of this as we break down the language so that all of us will be able to understand. One person who is going to help us is Dr. Gordon Awandare. He is a director for the West Africa Center for Cell Biology of Infectious Pathogens. At Noguchi, and he's going to help us do some discussions on the subject. Good morning to you, Dr. Awandare.
Good morning.
Now, if I read the statement of Noguchi, and then also do some critical literature reading, it tells me that the scientific community is on this journey to find out whether the virus originally, as recorded in Wuhan, has mutated into other forms or changed in other forms. Is that the understanding I get?
Well, good morning to your listeners. Let me explain that we are not claiming that the virus has changed significantly. What we're saying is that there are a few changes, but overall, the virus still looks very similar to the strain that was isolated in Wuhan. So what is important is that we have established the capacity in Ghana to be able to sequence the virus. In other words, to be able to study the virus's genome on a consistent basis so that we can track any changes that come. As you know, pathogens will change when they are challenged. The goal of every pathogen is to grow and multiply and infect more people. So if it encounters any challenges environmentally or in the humans that it infects, it will try to find a way around this. And one of the ways to do that is to change the genetic information that it uses to to encode or to guide its structure and function. So if we're able to track this on a consistent basis, if it begins to change in a significant manner, we will be able to know.
Okay.
And this is important because we cannot always rely on other countries to do these type of things for us. Right now, there's a global pandemic. Everybody is looking out for themselves. We in Ghana need to be able to also look out for ourselves. And that's why it's important that we have the capacity to do this on our own. And that way we are able to control our own destiny. So that is the significance of what we have done.
Is it important for the scientific community, people like you and the research institutions that you had, for you to know whether there's been some changes in the structure of the virus? Of what use will it be, I mean, literally?
Well, as I explained, the structure of the virus determines how it will interact with drugs or any potential vaccine. As you know, a drug or a vaccine needs to bind to the virus, or it needs to attach to the virus in order to have an effect. So if the virus changes itself so that a vaccine or a drug can no longer attach to it properly, then the effectiveness of the drug or the vaccine would go down. So that's why it's important to track these changes if there are any, because it will impact on the efficacy of any drugs that we try or any vaccines that become available.
Now, we do know that across the scientific community, we are still in the initial stages of developing either a vaccine or any drug to fight it. Now, if the current state of these developments continue, how would this finding that you have help you in trying to combat this with the various drug combinations you are using?
Well, you know, when you respond to a pandemic, you need all the information that you can get, or you need as much information about, you know, the pathogen as you can get. And so what this allows us to do is to be able to trace particular infections, where they came from, to be able to track any changes in the virus, and also to start doing our own research on how the immune system responds to the virus and whether there are any differences in the way the virus is transmissible, its ability to infect people, the efficiency of the infection. Is it different in Ghana or in Africa than is reported elsewhere?
There's something very poignant in all the information that has been communicated to the media, you, the scientific community, have done to us, and then to the general public. There are a number of cases for which they've been termed local infections. And the explanation is that they haven't come into contact with anybody, one, who has a travel history, has had any infection, or is not in the line or in the chain of having had any infection. Does it mean that they just develop the infection by themselves? Is that possible scientifically? And why would that be possible?
No, that is not possible. It's not that they developed the infection by themselves. What it only means is that they got it from somebody who may be asymptomatic. That means that the person has the infection but is not showing symptoms. So the individual would be unsuspecting in interacting with them. So they wouldn't know when they picked it up. They could also have picked up from the environment. Could be on a door handle, on a tabletop that they put their hand on, you know, on any item that an infected person touches, and you also go and touch that, and then put that on your face. You can get infected without knowing. And so there's no doubt that if you are infected with a virus, you've come into contact with somebody who has been infected, either directly or indirectly. So what this capacity we've demonstrated will do is that we can then take that virus, study its genetic material, and then compare it to the other viruses that we have. And we could be able to tell, possibly, you know, where the infection came from.
Scientifically, how quickly do the structure of viruses change, and what usually are the repercussions?
Well, it varies from one pathogen to another. So some pathogens evolve very quickly, others take much longer. So this virus, we are now watching it to see how quickly it would evolve and how far it will evolve. But these are the reasons why we need this capacity, so we can be studying the virus and see how quickly it evolves. But once it starts to evolve, then we need to look at the consequences. Which part of the genetic sequence is being changed, and how does that affect the structure and function of the virus? So for example, the virus it is able to bind to our cells using what we call the spike proteins, which are on the surface of the virus. So if there are changes in the structure of the spike proteins, would that affect the virus's ability to bind? Would it change its target cells that it binds, for example? So these are some of the things that will be important. And if there's a change, would that affect a vaccine that is meant to target the spike proteins? You know, if the vaccine is targeting the spike protein and the spike protein has changed significantly, then the vaccine would not be able to recognize it as effectively as it should.
Great. Now, you in the scientific community, we have seen that elsewhere across the world, all the countries, if not the developed countries, seem to be looking inward, trying very fast to grapple with this. So we have a lot of, well, in my plain man's language, trial and error actions being undertaken in the field of medicine to be able to just contain the treatment and spread. In Africa, in Ghana particularly, are we trying to also perhaps make use of what we have to be able to contain this in terms of whether it's herbal medications or trying to find the compositions of some other remedies?
Yes, I think we are. I think since this pandemic hit, we have marshaled all the expertise we have and all the resources that we have available to try to respond as much as possible. And part of it is what we are discussing today about, you know, being able to advance our scientific capacity to provide real-time information to guide the response. You know, as far as herbal preparations and others are concerned, it is good to have, you know, this type of local solutions, but we also need to be careful that we are not taking unnecessary risk and giving people false hopes. So if there's any herbal treatment that you know, people find to be useful or effective, it will be important that it is subjected to rigorous scientific investigation to confirm whether there's actually a specific effect on the virus before we can start to, you know, move forward with these types of interventions. So it's good to look at all these local options, but we have to be careful that we do not, you know, give people some false hopes about products that we may have.
How long have you been doing this type of work?
Personally?
Sure, I'm speaking to you in person, sir.
Well, I've been doing this for over 20 years. So, you know, I started doing research, you know, since my undergraduate days, and you know, but I got my PhD in 2007, and that's when I became an independent scientist. So I've been doing this a long time, and I mostly work on malaria, but my training is infectious diseases in general. So
fantastic. So
when there's a need for us to respond, we apply all our expertise to the problem at hand, and we try to provide solutions.
You African scientists, which in your field have you come across any groundbreaking research that has led to some commercial production of vaccines or some medications, etc., looking at the tropical medical problems we have? I'm asking this because there's this debate out there that African scientists really, they kind of just do the wishy-washy things and wait for the white man or the Asians. I know you're smiling. It's good you're smiling. And the Asians to come out with the groundbreaking research that ultimately leads to the pharmaceutical implications for medical health care.
Well, it's an interesting question. We hear some of that, but you know, it's the same people who are saying that What we've done now is not significant because it's being done elsewhere. So it's step by step. As a country and as a continent, we need to build capacity to do high quality science. High quality science is expensive. You need a huge investment in infrastructure and equipment. We know that we have the expertise. African scientists are all over the world doing fantastic science and discovering things. The missing link is that some of this is not being done on the continent because we don't have the necessary infrastructure to do the same thing. Some of us have lived and worked overseas, and then we've come back here. The same, brains that we use to work in those high-level institutions overseas, we have the same brains here. So that's why we have to gradually build the capacity to allow our local scientists to use the talent that they have and to apply it to provide innovative solutions. And that's what we've been doing. So if you look at the effort some of us have made, this is the type of mission we've been on for the last 10, 15 years. It's trying to develop scientific capacity. First you acquire the equipment and infrastructure, and then you train people. We need to train a lot of people locally so that they remain here and we can have access to their expertise. Okay? So these are some of the things that we need to be doing. We need to build capacity. And then we need more investment in biotech. When scientists do their research and find something that is interesting and has potential, then you need a biotech industry to then translate that into usable products. We don't have any of that. In Ghana, there's no biotech industry. It's non-existent. You understand? So we need to create incentives for people to invest in biotech. That will link the scientific knowledge to products. So that's the next step. We have high quality scientists. We need the investment that will take the knowledge we generate and turn it into product.
Okay, so I count this from UNESCO, and I'll read this to you. This was published in October 2019. And UNESCO, it has an institute called the Institute of Statistics. It's estimated that by 2019, Africa's investment into research and development was only 0.42% of its GDP. And even this fell far below the global average of some 1.7%. I mean, logically, it continues to say that China, the United States of America, and Europe, they lead the scientific world in investment into research and development. For you as a scientist at where you are, how does that impact the type of work that you do?
Yeah, that's exactly the point I'm making, that, scientific research is expensive. You need to invest, and we are not seeing the type of investment that we need in order to lay the foundation for scientists to thrive. So it's exactly my point. Several years ago, heads of state of the African Union committed to spend at least 1% of GDP on science and research. So far, I think only about 5 countries across the continent have achieved that. So there has to be more commitment. There has to be greater, commitment to send resources into these type of areas. In Ghana, we've been talking about a research innovation fund for a number of years now. We're still waiting for it to be done. This is the time to move forward with these types of initiatives, because we cannot continue to rely on, our development partners to do these things for us. We need to set up our own systems to consistently fund our scientists, so that this type of work we are doing should be on an ongoing basis. It shouldn't only happen when there's a pandemic, and then people are scared and then we start to get support to do this type of work. This should be something we should be doing around the clock, so that we are ready when there's a crisis. We don't have to be playing catch up. So I think it's a good opportunity that whilst we respond to the immediate need, we should be making serious commitments for the long term. We should be putting resources into setting up the capacity that we need to be globally competitive. I run a center where we train PhD students and postdocs. And I can tell you that the people I have here can work anywhere in the world. Indeed, some of them, we attracted them back from overseas. We have people here who were working at Francis Crick Institute in the UK, and we brought them back here. You know, these are top world-class institutions, and we've been able to convince them to come back here because they see that there's hope, and that we are creating an enabling environment here for them to be successful. So if we do that, if we make the investments and create the enabling environment, there are so many colleague scientists abroad who would pack their bags and come home. They want to come home, but they are afraid that when they come, their career would not move forward. So if we create the environment, we can get all our talent back here, or most of our talent back here, and we'll be very competitive. We have a lot of very smart Ghanaian and African scientists. And if we are able to harness all of them, we can compete.
Well, we have to start to winding our conversation up. But averagely, if somebody like you and all of you in this sector that you work want to undertake individual research, groundbreaking scientific research, what's the average cost?
Millions of dollars. So let me give you an example. My center, which is a relatively small center, compared to, or other places. My center, we run on a budget of $2 million a year. $2 million a year. And the vast majority of that is from grants that we win on the global stage, competitive grants that we win. So, and this is just barely making us, competitive, $2 million a year. So that gives you perspective. So Noguchi, for example, will probably need, $10 million a year because they are much bigger than us. Okay. So these are the types of investments that we need to make. Let's create a budget for science. It's good that the government pays salaries for, academics such as ourselves. But then we need the tools to work, we need the reagents to work, and these have to be made available. In addition, we need to have a deliberate, mechanism to facilitate science. As I speak to you, it's very difficult to get reagents that we need to do our work. It takes very long, for us to access reagents that we need to do our work. Okay? These are because of several unnecessary bureaucracies that we have in the country for procuring, scientific reagents. These are things we should break down. We should deliberately facilitate the work of scientists and make us, position us to be very competitive. Out there, those who are successful, they have done it in a certain way, and we know how they've done it. We need to do the same thing. We need to be able to do the same thing. We need to allow our scientists to have access to what they need in order to be innovative, and that is the way we will make progress on a sustained basis. Let me make a note that our center is actually one of the World Bank African Centers of Excellence, and this is a project that required a commitment of participating country governments, and the government of Ghana has consistently supported this project since 2013. So let's give credit that that is a sign of good faith from the Ghanaian government that they've supported the World Bank in this initiative to fund science, at the tertiary level in Africa. But we need this to be done on a more consistent basis and for the long term. We need long-term commitment for these things. If we set up centers and support them for 5 years and then allow them to wither away, allow all the infrastructure we put in place to basically go to waste, then we've really gone backwards. So once we have these types of initiatives going, government should endeavor to support them on a consistent basis so that, we can keep moving forward.
Now, the work that you do, how does that influence the public health sector in terms of treatment and then care at the base level?
We do several things that help. For example, the diagnosis that's going on at Noguchi, which we are supporting, that is because of the scientific capacity we have and the expertise that we have. So when the virus hit here, it was the scientists who were called to find a way to diagnose this. So diagnosis is an important element of the work that we do. In addition to that, tracking drug resistance, for example. You would remember that we used to use chloroquine to treat malaria, for example. Now, after some time, we realized that malaria was not very effective. It took scientists to prove this in a very, clear way that allowed, government to take the decision to change from using chloroquine to using, other drugs. And now we use ACTs, or artemisinin-based combination therapies. So these are the types of things we do. And for surveillance, as I mentioned, when there's a pandemic that is spreading, you can easily track the spread of the pandemic using some of the genetic analysis that we are doing. You can track the source of an infection using the genetic analysis that we are doing. You can basically track whether that particular infection would be drug resistant or not by looking at the genetic makeup with some of the tools that we are talking about today.
So what should we look forward to then? Apart from this, this one looks like groundbreaking, but we haven't gotten there yet, right?
Well, yeah, let's be a little bit measured. It's not groundbreaking in the sense that we have not discovered a vaccine or a drug. What we are saying is that we have made progress scientifically as a nation, that we're able to sequence the whole genome of a pathogen. This is what a whole genome sequence. We've sequenced the whole genome of a pathogen locally, using local capacity, using local expertise. We didn't have to send the sample anywhere. We didn't have to bring experts from the UK or the USA. We did this ourselves. That including the actual laboratory work, as well as the computational analysis that take place after the laboratory work. So after the laboratory work, you generate this data, which we call big data. And these data, you cannot normally analyze them on a regular computer because to crash the computer. So we've installed what we call high-performance computing capacity, the University of Ghana's high-performance computing capacity, which we call Zuputo. And this Zuputo can handle big data and allow us to analyze this data in-house. So we have PhD students sitting next door to me right now who are, crunching the data and trying to make sense out of it and providing information that would be useful in our control efforts. So this is what we are talking about, that we've established this capacity, and it adds to our, our ability. It empowers us to be more independent and to do more to help our people.
Now, as we just close this interview, or bring this interview to a close, over the weekend, we've seen